Hi, good evening. Steve Adler. Got a minute? All right, so we're going to go over the virus numbers. Not going to talk a lot tonight. I really wanted to start a show by playing the Walk With Me Austin song that benefits Ham that we went out with yesterday. But everybody tells me I can't start all these with that song. If you haven't listened to it, you should. Walk With Me Austin. You can Google it. But let's take a look at some of the numbers. We're going to go to the first dashboard we always go to. We're going to focus on admissions because that's the most reliable number that we have. And we see that admissions that were 7-day running average today is 13 because we had 17 admissions, higher than the 7-day running average. Yesterday we were single digits, 9 new admissions. We were at 12 for a 7-day moving average, so we have gone in the wrong direction by 1. You can look at the chart off in the center there, and you can see that admissions, which is graphed there, is kind of up and down, but relatively flat. That's kind of where we are right now. We have to redouble our efforts to wear masks, show the discipline, so that we can drive down infection in the community and these admissions that are showing. We really need to do that. We could do that. Maybe we can get down into that blue stage 2 area. But these are the hard efforts. People have to be really disciplined about masks and social distancing. Off to the right, you can see the number of cases. Yesterday, 78 cases. Today, 93 cases. Below the 7-day average of 110. That number's been bouncing around, 100 plus or minus, staying relatively flat as well over the last couple of weeks. Let's talk about hospitalizations, IUs, and ventilators. So we go to the next chart, which shows us how many folks we have tonight in those things. We can compare them to the 7-day running average, which was on the chart we just looked at. You can see we have 79 hospitalized tonight. 81 is the 7-day average, so we're down 2. The spread was greater yesterday, so we've closed some of that gap. ICUs 22, that's up from the number yesterday. But at 22, it's still one below the 7-day average. But again, we're closer to the 7-day average than we were before yesterday. Ventilators 15, and that is the number, is our 7-day running average. So we make moves down, we bounce up a little bit. Numbers are low, but we're kind of stuck at this plateaued place. The infectivity, as we saw yesterday, everybody's down 5%. We're down 5% as a community. Hispanic Latino population about 8%. So it's higher. We need to drive that down. So we're in an okay place. But if we really want to be able to sustain schools, sustain the opening of businesses, we have to drive the numbers down. But no real change. Let's talk for a second about how the city, we have a city council meeting tomorrow. We're doing a new additional relief, but just by way to summarize thus far, the city has distributed over $37.5 million, almost $40 million to people, not health related, but related to economic issues. We've given about $1 million to child care providers, $1 million to creative spaces, close to $1 million, creative workers, a little over $3 million, small business loans, 645,000 small business relief, a little over $13 million. Nonprofit organizations to sustain them, just under $4 million. For just residents, kind of direct rental assistance, $1.27 million with more money coming. I got an additional grant from HUD for rental assistance, utilities, and more. Those kind of direct payments, checks we cut to people, a little over $9 million. There's about $20 million that's currently being distributed, or is going to be distributed soon. I suggest everybody goes to atxrecovers.com. That's atxrecovers.com, and you can see what the current offerings are. At the City Council meeting tomorrow, just by way of update, we're going to pass the resolution appropriating and applying the increased funding for integral care which is the entity in our city that helps us with significant mental health crises and issues. This is for MCOT. This is the Expanded Mobile Crisis Outreach Team, EMCOT. We're increasing its funding by $3.2 million. That's part of what we did with some of the money that had been in police, APD direct spending it, moving it over to increase these teams. This fully implements the recommendation that was given to the city by the Meadows report about what we need to be doing in this city with mental health response. This includes expanding the staff to ensure that we have 24/7 access to trained mental health responders, professionals, increasing the access to telehealth resources by deploying tablets to first responders that are out in the field, access to one full-time advanced psychiatric nurse practitioner and a psychiatrist to bring specialty psychiatric care to people in the community. You know, we've had a lot of calls with our first responders that started out as someone calling to say somebody was in mental distress, calls that ultimately go bad. We're thinking that if we have mental health first responders to assist our police officers to be there to make some of the calls about what level of force is necessary, how to de-escalate situations, that we can make the city safer for all of us. Maybe we can divert some calls that police were otherwise taking to these other mental health first responder teams. We're also going to consider an item tomorrow that we're calling the SAVES resolution. This is a resolution to try to sustain some of our iconic places in the city that are facing imminent closure because they haven't been open, like a music venue hasn't been open now for just months. And when we come out of this pandemic, we still want to have these live music venues. We're not going to be the live music capital of the world unless we have live music venues and live music musicians, artists, and everybody else that's involved in that industry. It's a big part of who we are, makes us special, part of our brand, part of our economy, but no business right now. So we really have to focus on sustaining some of these businesses that are key to who we are. They're iconic or their legacy. They're facing imminent harm or loss or closure. And if they got some support, businesses that would be able to sustain themselves, the kind of businesses that if we lost them, they would not be replaced post-pandemic by a similar business in the same location. Because a lot of these, like music venues, are in areas where they could never pay enough rent to justify the location that they're in. So if we lose them, they're not going to be able to be replaced. But we're going to consider that resolution tomorrow. We talked about it on Tuesday. We were taking some of the money from some reserves that would help with homelessness and some transportation money. We just proposed on the message board we not do that we keep it simple, that we take money out of the excess sales tax revenue that's coming in now faster than what we had anticipated. And then we apply that to make sure that we can step in these situations. This is addressing music venues. It's addressing childcare so that we maintain that level of infrastructure. And I just think that that's real important. I'm excited that the council is moving forward with that in our city. And I anticipate that we will also be adding some additional money for ISD caregiver programs, food. We hire some of the restaurants that are also not struggling right now and pay them to do food for this program. So we get two things done at the same time. Another thing that we're doing to help with music venues and childcare and restaurants and bars, arts venues. These are some of the iconic stuff that are hurt the most, hurt the earliest, and had to close down the earliest. Going to be the last to come back. Reissued the order today on evictions. Made the order comply, be consistent with what our JPs are doing with the federal government's doing with the CDC, with our Supreme Court ordered with respect to residences. So it continues the prohibition on evictions for tenants that are paying rent at or below a certain amount. If you're paying at or above that, you would be liable for evictions unless you can complete the government's COVID harm affidavit. But we're also extending the eviction prohibition. Used to be to all commercial properties, no longer is, now focusing on extending that protection to music venues and restaurants, bars, and childcare facilities, arts venues. Again, these things are just temporary. They only go on for another couple months through the end of the year. But trying to preserve what it is that's special about this place. So on the backside of the pandemic, we recognize who we are, even as we're on a path to being a more just and fair and equitable city. With that, that's all the news. You all take care. Be safe. We'll talk again. Good night.